interesting quote that your business.
Sure.
Anytime, 2 seconds here.
Sorry.
It's a way to unnoise the problem.
You're right.
Ready? Good afternoon, everybody. Thank you all so much for being here today. We have what I consider a profound, hopeful, and exciting announcement, not only for the city of Lubbock, but for the state of Texas. In the last 10 days, we had a mother surrender their child utilizing the Safe Haven baby box located at Fire Station 9. Through her courage, she provided that baby a safe, protected, and well cared for environment. Safe Haven and Baby Moses laws provide the opportunity for mothers to legally, confidentially, and safely surrender their child, giving them the protection both to the baby and the mother. I'd like to shout out or say thank you to the crew at Station 9, who did an outstanding job providing care and assessing the baby. Our EMS partners, when they arrived, they continued that with compassionate medical treatment. I'd also like to acknowledge or recognize Turning Point Community Church, specifically Alicia Powell and Summer Strauss, for their tireless efforts bringing the Safe Haven baby box to Irving. Because of their commitment to the protection of life, in my opinion, they are heroes in this community. Now for the mother. I don't know your situation or pain, but I do know in your darkest moment, you had the courage and love for your baby to give them an opportunity at life. And we are grateful for that. We are praying for you, for your recovery, your healing, and peace. Thank you. I'd like to turn it over to Monica. She's the CEO of Safe Haven Baby Box.
Thank you, Chief, and thank you guys so much for joining us today. It is a good day when a baby is legally and safely and anonymously and lovingly placed inside of one of our Safe Haven baby boxes, because we all see the news where it's not a good situation. And this mother chose a loving, safe, anonymous surrender location at the Lubbock Fire Department. And, you know, we don't know your pain and we don't know your story, but we do know your heart, and your heart is very clear that you love this baby enough to bring this baby to a place where you knew that this baby was going to get medical care and a family. And the process has already been started. There's 3 reasons why we do a press conference after surrenders of our baby box babies. 1 is to talk directly to this mother. And 2 is to let people understand that this process, this department did exactly what they were designed to do. The box did exactly what it was designed to do, and the fire department did exactly what they were trained to do, and they did it flawlessly. And 3 is to remind the public that this box is still there. It is available 24 hours a day, 7 days a week, for any parent that feels that they may need to utilize this resource. Now, most of you guys know that I was abandoned as an infant 2 hours after my birth mom gave birth to me. This baby wasn't abandoned. This baby was lovingly, legally, anonymously, and safely surrendered into a baby box by a parent that wanted something more for them. So to the parent, thank you. Thank you for trusting us. Thank you for trusting the fire department to take it from here. Your baby is safe and your baby is healthy, and the process is working for a forever family to get the call that they've been waiting for many years probably. So next up, I would like to introduce Mayor McBrayer.
Thank you, Monica. This is indeed a wonderful day, and it's a great start to the new year. It's a wonderful way to start off a new year here in Lubbock. I express not just my entire community's gratitude towards everyone involved in this incredible life-affirming and life-saving operation here, because I think this community can be judged by how well it treats its most vulnerable and its most helpless ones, such as this newborn baby. In the hour of need for this baby and this baby's mother, this community didn't turn them away. We made a place to receive the gift of this infant. And how fitting it is for this community to open its arms and welcome this baby in the very season in which we celebrate the birth of our Lord Jesus. I know this community will join me in prayer for this baby and for this baby's mother, who made probably the most difficult decision, but loving decision she will ever make. And I also know that we will pray for and support the team of people who will be committed to the care of this infant as she experiences growth in a new life here. Lubbock believes that all life is sacred and precious. And through the help of Monica and the Lubbock Firefighters Association and the folks at Turning Point and foster parents who will be taking care of this child, we've been able to protect and give hope to this very, very special life. I'm forever grateful to Lubbock's Safe Haven Baby Box for the kind and loving individuals who will care for this infant, who was anonymously and legally, that's important to note, surrendered in what I'm sure was a time of crisis for the mother. The very reason we're holding this press conference, as we have said, is to make sure that mothers in similar circumstances as this mother can know that this resource exists here in Lubbock, and to let everyone know that the Safe Haven Baby Boxes worked exactly as they were intended to work. And it's just an amazing thing. This is the first baby delivered to a baby box in the state of Texas, right here in Lubbock. I always say, lucky me, I live in Lubbock. Lucky baby to be born in Lubbock, where this exists. Just as we receive this very special blessing, let us be ready to receive all that God will bless this city with, this community with, in the year ahead. And thank you all, and especially to all these people who made this possible. I'm now going to introduce our District 5 Representative, Dr. Jennifer Wilson.
All right. Good afternoon. Thank you guys all for being here. As Mayor said, I'm Dr. Jennifer Wilson. I'm the council representative for District 5. And as we now all know, a mother made the tremendously difficult decision to safely place her baby in one of Lubbock's Safe Haven baby boxes. You know, first and foremost, what matters most is what Monica said. The baby is alive and healthy and safe with a family and receiving the care that it deserves. As a member of City Council, this situation highlights why baby boxes are so incredibly important and our safe haven laws are so crucial. These systems are not political. They are practical, compassionate tools that are designed to save the lives of our most precious in times of crisis. You know, as a pediatric doctor, I can tell you that the first hours and days of a newborn baby's life, they are extremely fragile. Unsafe abandonment, unsafe living conditions can lead to some of the most devastating outcomes I've ever seen in children. And access to a baby box can mean the difference between life and death. You know, as a mother, making the decision that this mother made is often with panic and emotional distress, fear, but having access to the baby box made her one of the most selfless, tremendously courageous women that I will never meet. And I want to thank her personally for making such a tough choice to put her child's life before everything else. You know, as a mother myself to 2 girls, I understand the intense bond between a new mother and her newborn, as well as many of my colleagues do as well. And I cannot even imagine what she faced that day when she had to make that tremendous choice. But if you are out there and you are watching, from all of us here at the press conference, all of us in the city of Lubbock, everybody at Safe Haven, we want to say thank you. Thank you for your tough choice. You know, I want to also thank Monica in Safe Haven Baby Box. I got to talk to her when we put this box in and got to know her story. And I can't even begin to tell you thank you enough for partnering with the city of Lubbock to make sure we could provide such a valuable resource to our parents and the Lubbock community. Thank you to our local first responders who were doing exactly what they were trained to do. And they will tell you, if you find them and talk to them, they were just doing their job. But we couldn't do this, and this process wouldn't work without all of you. You know, we are all committed here in West Texas to protecting the lives of all of our children. And as a pediatrician, I can say with certainty, when a child is protected and given a future, we all succeed. And this was a true success. I want to strongly reiterate what we have said, that we have resources in our community. I want everybody to know that our baby boxes are located not only at Fire Station 9, but at Wolforth Fire and EMS, Covenant Children's Hospital, and at our Covenant facilities both in Levelland and Plainview. So if you are looking for a location, know that they are out there and utilize these resources. And I hope today serves as a reminder that every life matters, every single one. And that safe options and resources are available, and that no mother needs to face a crisis alone. Thank you. And I want to turn this over now to Mayor Pro Tem Christy Martinez Garcia.
Thank you, Dr. Wilson, and thank you all for being here. You know, I am a newspaper publisher, so stories are so important to me, and I always ask for details. But also as a mother and an advocate of families and community, this is such a great example that we can all be so proud of today. I get emotional, and I'm sure you do too, to know that someone took the time to think about a decision I can only imagine was not an easy decision. But it is something that just fills my heart, because these are the types of success stories that we want to hear about. Too often we get caught up in bad news, but this is great news. This is happy news for a community, and it also demonstrates about how when we work together, good things can happen for us all and for the future of this beautiful baby that I will now call Baby Lubbock. I think, you know, Mark said about lucky me, I live in Lubbock. No, blessed me, blessed us. We live in Lubbock, and that makes all the difference, that we have a caring community with resources, as you've heard. And if you can't even remember the number 911 or 211, you can come to a facility like this fire station, and I hope that won't be the last place that we put a safe haven box, because they are so important, as we all know now. And Lubbock, Texas being the first city, we now have an example of what needs to be done. One of the questions that I asked our firefighters was, because I want to know detail. And at first, when they saw that the baby box went off, they got terrified. Or first they thought it was a test. And then when they actually approached and saw that there was a baby there, they were terrified, but immediately got in control and put all the lessons that they've learned about this into action. And one of the things that was also profound for me was when they picked up the baby. At first it cried, and it went back to sleep. Isn't that awesome? That's how safe that little one felt, and that's what it's all about. So, you know, Dr. Wilson mentioned Monica's story. I think we were both so touched when we first heard her story. And I think that's the first time that we unveiled this. Never did I expect that we would experience this, and here we now are. We can now say that we have done this collectively. So I want to thank our first responders once again for putting that safe feeling and effort into place. I want to thank our Safe Haven baby boxes as you guys, Turning Point Church, the ideal of all of this coming into fruition. Who would have thought? And yet now we have given young women or women in general an option. And it just really is something that we can all be so proud of. So again, thank you all. And at this time, if you have any questions, we have folks that are ready and willing to respond and help any way that we can. Thank you all for making Lubbock that much safer.
Thank you. So Lubbock has so many baby boxes now. I think we're at 4, right? And so what is the reason behind Lubbock quickly moving to install so many? Is it because of specific data showing this region needs more?
You never know when someone's going to need a baby box or where they're going to need it. We find that a lot of our moms that utilize our boxes don't have driver's license. And so if we can get a box on the south side, the north side, the east, the west, to where she doesn't have to walk, but still gets anonymity or walk far, sometimes that's why communities do it. I see a time in our history, probably within the next 20 years, where no fire station in this country will not have one. And so I think that's just where we're going.
Yeah. So with that being said, can we expect to see more in Lubbock?
We will be here next Monday blessing a box at UMC. So yes, we are going to be, Texas is the #1 state in America right now for infant abandonment, and we have to change that. And so the more boxes that are being put in, the more we can work in communities, educating our first responders, educating the schools that this is now available anonymously, but also reminding the public that this has always been here. You just have to walk in and hand the child to a person if there's not a box available. And so we're coming into Texas and we're trying to help communities like Lubbock change the outcome, because we've changed the outcome here in Lubbock. This baby had a safe place to fall. And it's because everybody said yes, and the church raised the funds. I don't think, Mayor, correct me if I'm wrong, but I don't think any tax dollars went into this.
No.
0. And so it's the community that's bringing this, the community members that are bringing this. And that's what it's all about, is when we're the hands and feet of Christ doing his work. So.
Absolutely. And when I've worked with you in the past, we talked a lot about how amazing it is. There's resource packets inside of these baby boxes. Are you allowed to share, did the mother take this resource packet?
Can I say? She did take the resource package. Let me just say that. I don't know if I'm supposed to say that or not, but I'll just do it because I run the job. I run the place. So, so why not just say it? Yes, she did take the information packet, but that's so important for, even if she wouldn't have taken that packet, the resources are still there for her to utilize. There is free counseling. She contacts me today. I will get her in contact with our licensed counselor tomorrow. We want to help this mom. We don't want her to battle this alone. We want her to find peace in the decision that she's made and not hurt privately. We want to walk alongside her on this journey that she's chosen for her and her child. And the only way that we can do that is if she reaches out to us.
So this baby box number 5 going in Lubbock, so exciting to see how many resources are going around our city. Was this pre-planned, or was this already put into motion before this baby was safely surrendered?
This, actually, I believe when we started talking with Lubbock, we also started talking to the hospital. So Lubbock didn't mess around. They're like, we're going to do this. With hospital, there's a little bit more regulations, and you have to kind of do a little bit different things at hospitals. But it's been a while. We've been working with them for a while. It's not something that just happened.
Would you say, I don't know if you're allowed to, but is Lubbock one of the easiest cities to work with when it comes to putting these boxes? And I feel like we have the most in the state, if I was reading right.
Lubbock, it's so nice to have people that think the same. And you don't have to fight the politics. We didn't have to fight the politics here. And everybody understood the problem. I mean, we blessed the box last year, and 2 days later, we had an abandoned baby in the city. And so they seen the problem, and it wasn't hard for them to see the solution. And so now we've seen the solution because we have this beautiful baby that's been placed in one of our boxes. And so I think more boxes are going to pop up even around Lubbock. But as for Texas, this probably was the easiest location to work with because they think like we do. They see the problem.
Yeah, absolutely. And then when it comes to fire station number 9, we were talking how at first we thought this was a test because these boxes get tested pretty frequently. Right?
Every week.
Every week. And so how does it make, you feel working with your men and women, first responders, to know how quickly they were able to get on their feet and to help this child and then get in touch with the church and the hospital and all the things?
Quite honestly, it's what I would expect. The men and women of Lubbock Fire Rescue are phenomenal, and they act. And when that alert came in, they immediately, they may have been scared, nervous, terrified, but they acted, and they acted professionally with love and compassion.
Beautiful thing. And I think one of my final questions is, so we're the first city, if I heard this right, in the state of Texas for this to be successful and a baby to be safe. How does that make, our councilmen and women and you, Mayor McBrayer, how does that make you feel about the city of Lubbock?
I can't always speak for all the council, but I think on this day I can speak for all the council. We are extremely excited, pleased, grateful to be the location. We hope we are not the last. We hope that this press conference helps to alert more people to what's out there, to the availability of the baby boxes, because it's something, as Monica said, we're very committed to here in Lubbock. Lubbock believes in the sanctity of life and protecting life, and so this is we're excited about this. It makes us all feel great. It's the best New Year's present I think we can have around here.
Baby Lubbock, as you call
Baby
it.
Lubbock.
Sweet. And I think one of my final ones is, how are we allowed to share how long the baby was in the box before it was safely in firefighters' arms, and then how the foster families get involved later?
It was less than a minute. That's all I can tell you.
That's typical too. It's right about a minute.
Wow, very quick. Okay,
Christian, can I, how many babies have been safely placed in these boxes since the very first baby box ever out in public?
We've had a total of 74 babies in the boxes and 187 handoffs since November of 2017. And we have 410 active boxes across the country.
So then you said, I'm sure this is the case, but this baby box is open 24/7, so any time of the day, any day of the week, these parents can come and deliver their babies?
Correct. We use technology to notify the staff if they're out on a fire to come back to the station because their baby box has been activated. So we've taken technology and utilized that to our advantage to notify them if anything is placed in the box, whether they're there or they are out on a call.
So and then can you tell people the detailed process from the minute baby is placed in the box to the next step to put it into either a hospital or vice versa?
So as soon as a mother places the baby inside the baby box alarms start to go off. She doesn't hear anything. The first responders take baby from box, give immediate medical care. 90, I'm going to say 5, maybe even 97% of the babies that come through our baby box either have their placenta still attached or their cords are cut and clamped off with something. We know that they're not born in hospitals, basically. So they give immediate medical care at the fire station. They place the baby in an ambulance and take it to the closest medical facility for a medical evaluation. At that point, the Department of Child Services gets involved, tries to find a foster family, and then in the meantime, they're also looking for a forever family for this infant. Usually, an infant can be adopted about 6 months. They're going to be in the forever home, though, usually within 30 days, but the paperwork takes a little bit longer. But usually 6 months in most states. This is the first baby in the state of Texas, so I can't give you what Texas's normally is. This will be the run of how long it takes the Department of Child Services to get this baby continued through to adoption.
Can we share if it's a boy or girl or where they tell in that 60-day period?
The baby was within the legal age of surrender. I don't think we're saying that the sex of the infant just as respect for the parent. But this baby was legally surrendered under the Baby Moses law.
And if by chance a mother was to change their mind, is there anything they can do at that point?
If the mother is out there and she is questioning whether she wants to change her mind, she can contact the Department of Child Services and start that process. Don't call the fire department, don't call Safe Haven Baby Box, just need to call the Child Services in the state of Texas and start that process, because time is of the essence. There's only a select amount of time for her to be able to do that.
Monica, talk about the crisis hotline. There's a lot of marketing behind this, that if a parent is in need, they need to contact the crisis hotline. What is a crisis hotline intended for, and what are the resources that are tied into the crisis hotline?
That is probably one of the biggest expenses that Safe Haven Baby Boxes has, is our crisis hotline. One, because we have to market it, and market it means education. But we want these moms to call us, because we're not going to judge them, we're not going to shame them, and we're definitely not going to tell them what to do. What we're going to do is give them the options in the community in which they are at. So if somebody from Lubbock calls me, they have the option of parenting, they have the option of adoption, they have the option of walking into a facility and placing their child with a person, and they also have the option of placing their child in one of those boxes. We're going to give those 4 options to this parent that calls us from Lubbock, and then let her choose, because she's got to live with this decision. So us making that decision for her is just, it's unethical for us to do. And so once she makes that decision, then we'll walk alongside her on whatever she chooses. We have done a ton of adoption referrals to agencies in different states. We don't handle adoptions for obvious reasons, but we contact adoption agencies in the locations in which they are, these moms are at. And then also parenting plans. We have crisis pregnancy centers all over the state of Texas that can handle a mother that wants to parent her child. And so getting this mom into the doors of these crisis pregnancy centers is crucial for them to be able to parent this child. And that's their lane. That's not our lane, you know. And so get them into the locations that can help them best. But the crisis line, it's the number up here. We average 3 calls a day. From every state in this country, whether there's baby boxes or not.
Chief Stewart, we're talking today about Safe Haven Baby Boxes, but the Baby Moses law is still in effect across the state of Texas, where anyone can go to any fire station, any EMS station, or any standalone ER. So can you highlight that?
Yeah, that's correct. And Monica was mentioning that earlier. The law, not only just the baby box is one component of that, but they can go to any fire station, EMT or EMS station, or any other designated safe haven location and hand the baby off to a person. They can't abandon the baby, but they can hand it off, correct?
Correct.
Yeah.
And there are no questions asked?
No, same as the baby box, completely confidential. They may ask a question about medical history and to treat the baby, but otherwise there's no questions.
Thank you. Last question for you, Monica. With this being first surrendered here in the state of Texas, what do you hope are the rippling effects across the state of Texas with this surrender?
Well, I hope this brings education to the residents of Texas that this works. It's not a question anymore. This worked flawlessly in the city of Lubbock. This mother got exactly what she had asked for, which was anonymity and placing her baby in a secure location, knowing that this baby was going to be picked up in a matter of minutes. We want these women to use these boxes if the alternative is a dumpster. That's what we want here. And with Texas being the #1 state in the country for infant abandonment, I think, and not last year, we haven't got last year's numbers yet, but the year before, there was 33 infants abandoned illegally just in the state of Texas. If we can cut that in half this year, cut that in half next year, and just continue to dwindle it down with education, awareness, and educating our first responders, I think we can do it. So that is my goal, to hopefully get everyone educated in this state and combat that infant abandonment #1 spot and get you guys off of it.
I have a question, and Monica, don't leave. And I think it's an important question because you've heard that no tax dollars were used for this. This was based on fundraising and donations. Monica, if people wanted to make a donation First of all, how much does one of these safe haven boxes cost?
So the box alone is 16,000, and that's with the training, the media push, the signage. Then there's installation on top of that. So there are some fees that are on top of that you have to hire a local contractor to do that we don't do. But if they want to make a donation, they can do it at shbb.org. They can even specify that they want their money to stay in the state of Texas. They can earmark that. And so a community that is fundraising that hasn't met their goal yet, we can actually give that to them in the state of Texas. So shbb.org.
And if they wanted to give it specifically to Lubbock, could we do that?
Yes, I just put Lubbock, Texas instead of Texas.
Thank you. Thank you all for being here.
Thank you.
Well done. Good job. You guys act like you've
You're
done this.
welcome. Good to see you.
I've never done this.
You have been watching a news conference on from Lubbock Fire Rescue this afternoon as Lubbock Fire Rescue received its first ever Safe Haven baby box surrendered, the first ever here in the state of Texas. Let me grab some notes real quick. According to Lubbock Fire Rescue Chief Richard Stewart, the mother surrendered her baby at the fire station's 9 baby box within the past 10 days. As I mentioned, the baby was found. The baby was safe. It was taken to for medical evaluations by UMC EMS personnel. The baby was found healthy and is now in the care of appropriate medical and child welfare professionals. Just a great thing that has happened within the past 10 days here. Within this is a historic moment. As I mentioned, the first ever Safe Haven baby box surrendered here. The surrender occurred in accordance with the Texas Safe Haven laws, which allows a parent in crisis to safely and anonymously surrender an unharmed infant. Under the placement of the baby box, Lubbock Fire Rescue personnel were notified immediately within less than a minute, according to the fire chief. Then they responded within seconds, of course, to provide care for this infant. Just all in all, this is just a great thing. Now, there's also 4 other Safe Haven baby boxes located within the Lubbock area. Of course, Station 9, Lubbock Fire Rescue Station 9, Wolfer Fire and EMS Station, Covenant Children's Hospital, as well as Covenant Health in Levelland. Now, if parents need immediate help or any information within this, there is a 24/7 support line that they can contact. That number is 1-866-99-BABY-1. That hotline connects you to trained advocates who will help you with that, with all of this. Just a great day for the city of Lubbock and just the use of this baby box. Now, another baby box will be blessed next week. This will be at UMC, according to officials that were just talking in this news conference. But all in all, this is just a great day in Lubbock, according to Mayor McBrayer, and you heard from other city council members, as well as the fire chief, as well as also Monica Kelsey, who is the CEO of the Safe Haven baby boxes. But that'll do it here from the Digital News Desk. We'll have much more on this regarding the release and any other information that we have on this story at kcbd.com, as well as on our social media platforms. I'm Bobby Vanali. Take some time to really enjoy your life today, guys. Have a great day and a great rest of your week.